You're tuned in to the Dr. Kinney Show, and I'm your host, Dr. Erin Kinney, a naturopathic doctor and speaker dedicated to unraveling the mysteries of your body and guiding you back into balance. Let's get started.
Hey, real quick, guys, before we start the episode, I want to share something that I'm really excited about. I know how hard it can be when your hormones feel out of balance, low energy, mood swings, and not feeling like yourself, which is why I created the supplement line Optimal Harmony. With natural science-backed ingredients, it's designed to support your hormones, stabilize your mood, and help you reclaim your energy and confidence, because when your hormones are balanced, everything feels easier. You deserve to feel amazing every day, so let Optimal Harmony line of supplements help you get there. Hey everyone, welcome back to another episode of the Dr. Kinney Show. This week I'm really pleased to have back on the show Dr. Marisa Catapano, who is another naturopathic doctor and has become a really dear friend of mine. She practices locally, and she's not only a naturopathic doctor, but she's what's called a FABNO, so she specializes in oncology, which she's going to talk about today. So thank you so much for being back on the show.
Thank you so much for having me. It's awesome to be
fun.
here.
Yeah. So she was on the show, was that a year ago maybe? Probably about a year ago, and she talked about a therapy she does called neo-emotional release. We'll talk about that a little bit today, but I wanted to really highlight the work that she does with cancer patients. So do you want to start by sharing kind of your personal journey as well? Because I think it's really powerful.
Absolutely, yeah. I mean, my first introduction to naturopathic medicine at all was because my mother got diagnosed with stage 4 breast cancer. Yeah. And so she was one of those people that really, she wanted to avoid the toxic treatments as much as possible. So she did work with the conventional oncologists and do some treatments there, but she also worked really closely with a naturopathic doctor. Yeah. And her conventional oncologists honestly were amazed at not just like how she looked and felt, but actually how her disease was responding to even what they were doing. They were like, I don't know what you're doing, but I honestly don't want to know. And that kind of was surprising to me because I was like, you see someone doing so well.
Yeah, why wouldn't they want to know?
Don't you want to know? Like, what's your secret?
Yeah.
So it was just so beautiful for me to witness how the cancer diagnosis really sparked my mom into her own just like whole health and wellness journey, and how much naturopathic medicine really helped her. And so, you know, I was in undergrad at the time, not really sure what I wanted to do. I knew I wanted to do something with like mind, body. And as soon as I found out about naturopathic medicine through her, I was like, this is what brings it all together. Yeah. So I feel like it's just been a journey from then through school, through residency, to now where I'm actually treating, you know, patients just like her on a daily basis. And it's just so beautiful to be able to do that.
Yeah. Yeah, it's really cool. And how long have you been in Maryland now? Is it 2 years?
Just a year.
Really? It's only been a year?
I know.
I feel like it's been longer.
I know.
Yes, and you moved from New Hampshire, right?
Yes, that's where I did my residency, 2-year residency, where I was seeing not only oncology patients, but probably about 50%. And I think that was great because I got so much exposure to cancer patients all over the spectrum, from prevention to active treatment to even survivorship. Yeah. But then also, you know, not just kind of making that the only thing I know how to treat, and still seeing people with all, you know, conditions and all walks of life, so that it's really, you know, well-rounded. I feel like my experience there.
Yeah, which is really cool.
Yeah.
And cancer, I feel like, is such a tricky diagnosis. And our clinic, I typically don't treat patients that are actively undergoing cancer because it's just not my specialty. And I don't have it. Maybe we want to talk a little bit about FABNO, which is like a really cool certification. You want to talk about that actually now?
Absolutely, yeah. So naturopathic doctors that go through, you know, what I did in terms of residency and get extra training in oncology, we get a designation of FABNO, which stands for Fellow by the American Board of Naturopathic Oncology. And so this is the only board certified specialty in naturopathic medicine. And it is a pretty rigorous process. So for me, myself, I went through the 2-year residency. There were some case write-ups that needed to be done after that. And then there's a whole examination process. Yeah. And so it is really quite thorough. Yeah. So what's amazing is that, you know, there is a board really being careful about who is qualified to treat patients with cancer, because it's different than, you know, just your run-of-the-mill like hypothyroid who's also on the levothyroxine, like how do we support them naturally and with nutrition. Cancer patients are on so many medications. I mean, you have, you know, the chemotherapy drugs, but then the drugs that they're on to manage like the diarrhea and, you know, the neuropathy and all the things, the pain that comes from that. So it's a lot of drug herb nutrient interactions you have to watch out for. And then there's also just with that population of people, it's really, there's a lot of other things you have to consider. Of course, the mental, emotional aspect as well, because, not just leading up to their diagnosis, but following a diagnosis of the sorts of things that they're struggling with. Lots of people, unfortunately, come to us when it's sort of the last stitch effort, and we're talking end of life stuff here. And so if you're not familiar with having those kinds of conversations with people, it's hard for just any old naturopath to really treat. So it's so important to have someone who's not only going to make sure that your plan of care is individualized and effective, but it's safe and synergistic
with everything else you're doing.
Everything else you're doing, 100%.
And I think what's so beautiful, is that you can do your conventional oncology treatment, which sometimes that's what you need to do, but you can use naturopathic medicine, use that to help mitigate some of the side effects, and use that to address some of the mental, emotional things that come up, or, and then I think right after you've undergone treatment, that's where naturopathic medicine can really shine. Hey, you're a survivor. And there's so much PTSD, there's so many complex things that can occur from the meds and the chemo and all those things, and I think we can, our profession can really help you that. But you really want someone who knows what they're doing, who is researched all the different meds. And think about oncology, they're coming out with new drugs all the time and new treatment protocols, and I personally have just been I don't have the time and space in my life to be researching that all the time. And so I'm going to stay in my lane and do this and refer to people like Marisa to to help with those cases.
Totally. And you bring up a great point about the survivorship period too, because once they're done with active treatment, aside for maybe some monitoring every now and then, the conventional oncologists are largely just just go,
see you later,
live your life.
Free.
And it's really such a hard jump.
And
there's so much that people are just how do I prevent this from coming back? And conventional oncology doesn't really have a lot of answers for them. And so one of the most incredible things that I hear time and time again when people come to see me for oncology care is that they feel empowered and they feel hopeful, and they feel like there's things that they can do for themselves, because of course there actually are many things in nature, from nutrition to supplements to sort of more natural treatments that actually have been shown in the research literature to impact different types of cancers. And so you want someone, of course, who knows that.
Things,
I always say, I'm no one's dirty little secret. You can tell you're a conventional oncologist, you're working with me. If they have questions about why I'm recommending what I'm recommending, happy to show you the research. That's absolutely,
and happy to have a conversation. I think what's so beautiful about this is I think with any type of chronic complex disease you're managing, you want more people on your team and you want them to be collaborating, right? And I think that's when you'll get the best outcome, right? When you're so it's definitely helpful to be working with a conventional provider that is open to you doing these other things. And you want to, especially with cancer, you want all providers to know all the things you're doing, right?
Absolutely. Yeah. And it's really such a spectrum of conventional oncologists that I've seen. I mean, there are some people that are really on board and really open. So they're oh, I'm not familiar with this. But when we show them, the research behind it, they're
cool.
Oh, okay, cool. And then there's some that are questioning
not.
your credentials and you're, just really just so opposed to it. And that's more than anything, it's really impacting the patient because they're sort of caught
what
in the middle.
What do I do?
Who do I believe? And it's so tough to put someone in that position. But I always try to tell them, it's not, I like to think it's not their fault. It's just they're not educated.
Or they haven't had an experience with it.
Right. And they don't have the time to educate themselves either. Because it's when you think about a conventional oncologist, they are busy all day long. They don't have time to research the effect of curcumin on breast cancer. That's my job. That's my area of expertise,
But I think if you're listening to this and you're someone who's experienced that before, wow, I've got on the one hand, I've got this one, and this might not even be conventional versus alternative. You might just have two doctors that completely disagree. And that's super stressful because you're wait, I don't know what to believe. What do I... So I think the message here is you want to work with providers that are going to work together. And if they have differing opinions, that they'll talk to each other and be well, let's work this out and figure out what's the best for this patient.
Absolutely.
Because you don't want to be in that situation where you're which one do I... And you don't want to be worried about pissing someone off or upsetting someone. That's not helpful for your healthcare, right?
No, and it's it's really about ultimately what is best for the patient. So the openness to collaboration, I really hope that that's something that is becoming more the norm, as conventional medicine, is evolving, but also as naturopathic medicine is becoming more at the forefront and more people are wanting that there will be the openness on the other side.
Yeah.
Because that's, I think, what's ultimately going to produce the best outcomes, right?
Yeah.
When it's not like
we work together.
Exactly.
Yeah.
So that's the dream.
Yes, it's like we all want to work. Well, and I think there's so many cool examples like CTCA, right? The Cancer Treatment Centers for America.
Yeah.
They build these beautiful, teams of all these different types of providers, and they all work together, and it's super cool.
Yeah, it's really amazing when that can actually work well.
Yeah, and I think you see great outcomes, right?
Absolutely.
And I know you see great outcomes in your patients, right? When they have a good, solid team and they're...
Yes. Yeah, it's that quality of life first and foremost. I feel like that you just notice such a shift with people when they start working with me, like from the nutritional aspect to supplements. All of a sudden it's like, we're getting chemo infusions, they literally can't get out of bed for days. Yeah. It's like, oh, that's starting to ease up a little bit. I'm starting to have more energy.
Yeah.
I'm able to do more. I'm able to interact with the people I love more.
Yeah.
And there's just that freedom that comes from that. And then, of course, with the outcomes, it's always the question of, can you cure my cancer? Or how long will I live if I work with you? And it's that's one of the things where if we could get more collaborative with conventional medicine, and start to do those studies to really have hard data. It's always I can only tell you what I've experienced, and I've seen
there's not research for that. Yeah,
there's not a ton of data, but I mean, I can tell you, I've seen stage 4 pancreatic cancer patients that are given 6 months to live that live 3 years.
Yeah.
And so I can tell you that statistically, but also you're an individual.
Yeah.
So we don't pretend to, have the total power. It's really about how can I use the knowledge that I have of this medicine, of what's going on in your body to best support your body to do the healing it needs to do.
Yeah. Yeah. Pretty crazy.
I know.
So what would you say what's the most common type? Is it breast cancer, the most common type of cancer that you're seeing
for
around
women?
Here?
Very common. Yeah. Men, of course, it's going to be prostate. Lots of colorectal cancer too. Yeah. But every now and then, something comes up that's I've never actually.
Well, that's an interesting type.
That's an interesting one. You don't see that too often.
Yeah.
But those are, I would say, colorectal, breast, prostate. These are going to be the most common.
The most common ones. Yeah. And maybe let's talk about are there some general diet, lifestyle things that you're recommending to a lot of your patients with their undergoing treatment? Yeah.
Totally. So one of the biggest things that people come in is I heard sugar feeds cancer. Mm-hmm. And this is true to some degree, right? Yeah. Because if you even think of a PET scan, which is how conventional oncologists find cancer in the body, they're basically giving the patient radioactive glucose and then seeing on the scan where lights up.
Yeah.
Right? And it's because cancer cells do have more glucose receptors than normal cells. Yeah. So they take that glucose up a lot faster.
Interesting.
So it is true that sugar feeds cancer, but we can never have the blood sugar be zero, or we kill all of your cells.
You have to have sugar,
So you have to have sugar. So what is the balance, right? Is how do we limit the excess sugar so that we're not, you
just don't want sugar floating around in the bloodstream. You want it inside your cells, right? You want the sugar, the sugar to be taken up in cells so they can do their job and give the cells energy.
Exactly. And the other piece of it is too, right? Sugar also feeds inflammation. Yeah. So when people are consuming lots of starches and sugars and their blood sugar is spike, crash, crash, that is really destabilizing for the body. Yeah. And cancer thrives in an inflammatory in an inflammatory environment. Yeah. And so it's not just about the sugar feeding the cancer, but also the sugar feeding the inflammation. And so my general approach, and I do use the blood type in terms of nutrition to personalize a bit more, but generally high protein, low starch and sugar, incorporating really great healthy fats.
Yep. Fruits and veggies.
Lots of probiotic foods, cruciferous vegetables, broccoli, Brussels sprouts, cauliflower all day long.
All those things.
That's really, I think, the biggest thing is we just want to make sure there's not an excess of sugar that the cancer can fuel itself with.
Yeah. Yeah. And that's all pretty, that's general good diet advice for anyone, right? Yes, it's going to prevent cancer, but it's also going to reduce inflammation and keep blood sugar more stable, and which is going to make most people feel better in general, right?
Absolutely. It makes so much sense. I think it's hard for a lot of people to wrap their minds around sometimes, because even fruit is sugar.
Yeah. But you're no, you can eat fruit. right?
To a degree.
To a degree, yeah.
Like like sugar is sugar. Ultimately, the body doesn't care if it came from a blueberry or from a cupcake. Like there's other things in the cupcake, of course, that make it worse. But it's still in terms of sugar. So it's really like in active treatment, especially, we really dial it down with the sugar intake.
Got it.
And really just focus on the protein. But what's tricky about that too is like sometimes during chemotherapy with appetite changes and nausea, like the last thing you want to have is a steak and broccoli, right? So it's always like meeting the person where they're at, and it's like, okay, can you handle like a protein shake with some berries or some cacao in there, right? Can we open a multivitamin and put that in there? You know? So
trying to figure out a way to like work around with the chemotherapy.
Exactly. Using ginger for nausea is a really, really great one as well.
Yeah, so there's lots of really cool natural things that can help like counteract some of these side effects and things.
100%.
Yeah, it's wild. Well, let's touch a little bit on, I know we did a whole episode on the neo-emotional release, but let's talk a little bit how that plays into like cancer treatment and emotions and all these things. I mean, we know we talked about like the things that get brought up during diagnosis and treatment, but then sometimes when we haven't been dealing with an emotion, sometimes that can actually contribute to certain physical states in the body, including cancer, correct?
Yeah, absolutely. Cancer's no exception to that. So one of the things, psychosomatically that I have found really fascinating, something I looked into a lot when my mom was diagnosed, the type C personality. Have you ever heard of this?
I think you have actually explained this to me, but let's tell it again.
Yes. So the type C, you probably heard of type A personality, right? That's like more prone to heart disease and things like that. So the type C personality, actually research has shown, is more prone to develop cancer. And type C are like, maybe you know someone who's had cancer and it's like, oh, but they're just like the nicest person. The nicest person. Everyone loves them and you just feel so like warm and welcome in their presence. And that's because the type C personality is someone who is like very cooperative, very conciliatory, always like trying to keep the peace. They are very conflict avoidant. They also are very much in this almost like, stay positive kind of mindset where it's like especially any negative emotions are getting pushed down. And this is sort of like, almost like the fighter archetype. Like when I get diagnosed with cancer, it's like no emotion, just like, okay, what do I have to do? Like I'm going to do it and I'm just like going to get through it. And there's just, very logical, very positive. And this has really been shown to actually, again, it's not necessarily the cause, but there's a correlation there. And so when you think about a cancer, right, like it's something inside that's growing just really uncontrollably.
That your immune system hasn't recognized and it doesn't want to kill it or it doesn't want to get rid of it. Right?
It's very good at evading our immune system. And so, on a psychosomatic level, when we stuff things down, of course, we know they don't actually leave.
Yeah, it's just sitting there.
They just fester and grow and grow and grow like a cancer. The other really interesting thing I think psychosomatically with cancer is, if you're familiar, anyone's familiar with the work of Dr. Zach Bush, he talks about how the cancer cell is the loneliest cell in the entire human body. And so we're learning a lot about how cancer actually develops. And we used to think like it's just one cell that develops an irreversible mutation and starts to rapidly divide. But we're finding out that actually what causes the mutation is it's the environment. It's the disruption in cell-to-cell communication. Which means that basically this cell
is not being able to talk to. It's lonely. It's isolated.
It can't talk to the cells around it. So it starts to believe that it is the only cell.
So it must procreate from whatever it's. Oh, that's interesting.
Exactly. So it divides, thinking that it's the last shot at survival for the entire organism. But that's only because its communication has been lost. Oh, that's interesting. And so it's really, when you talk about disease is disconnection, this is a really powerful manifestation of that. And so when we reject certain parts of ourselves, certain experiences, certain emotions, we disconnect from them, right? This is being mirrored in the physiology, but also on the grander scale, like why is cancer so rampant in humans as a whole? we have largely disconnected ourselves from nature, from the
from
earth.
each other. I mean, we're connected to technology mostly, right?
Exactly. So this loneliness and disconnection
is really manifesting in the human body.
And I find this a lot in my cancer patients where they're, either physically isolated or where they're, they've just stuffed down for so long, or like, difficult conversations with my husband, like I just avoid. I'd rather avoid it rather than, so it's just like really hiding these parts of themselves, whether consciously or unconsciously. And so realizing that and starting to get curious about what is the path to reconnection, I really feel is one of those ground up root causes that we have to look at when we're dealing with cancer.
What's interesting is, I think, like you were talking about, like type A's, and and again, all the different types tend to have more of a predisposition to something. But what you're saying, it's almost like they're not wanting to look at something in their life, like this type C person, and it's almost like in the body's like, well, I know those cells are growing over there, but I'm not going to look at that right now. Like, it's literally like you're mirroring the same thing that's happening, right? Because the immune system should be like, wait a second, what's going on over there?
Right.
Why are those isolated cells dividing? They're not doing the right job, and they should go and like trigger something to call, like it does apoptosis, right? The cells are supposed to actually know, like, I'm not doing the proper job, I should kill myself. Right? Like, that's kind of what's supposed to happen, but those cells are not doing it. So normally the immune system should go and be like, no. Which is like the complete opposite of someone who develops an autoimmune condition, right? Because they're like, they're really strong. They're the ones that love confrontation, and they're like, I'm going to yell at you and I'm going to do this, because their immune system is like, I don't know, you look sort of not right, we're going to attack you, right?
Yes.
Like, which is so different from someone who's like so nice and loving and inviting and like, well, you're okay, like, I'll let you in here, and I'm going to, if you bother me, I'm not going to say anything.
Yes,
so it's so interesting how that mirrors in the body, right?
Yes, so beautifully said too. Yeah, the autoimmune is so different because it's like people who are often super hypercritical, right? Like always attacking themselves, and that's often mirrored
in the body. Right.
Yes. Yeah. And also in how you look at other people. If you're judging yourself harshly,
you're going to be judging others.
Versus the type C that's like, no,
loving.
Everyone is amazing. Everything is great. We're all fine.
Yeah. And that is really it is really true when you think about someone like, wow, they got cancer, and you're like, they're the most amazing person.
Oh,
like,
yeah. I mean, that was my mom 100%.
Sure.
I mean, it's the mothers, the caregivers, like people who...
The ones that are just giving and giving and giving and not taking care of themselves.
Exactly. Like almost to a point of like self-sacrificing.
Yeah. And it's, I mean, I think, it's wonderful to have that part of your personality, right? To like be able to self-sacrifice it, but you just don't want to be doing it all the time.
Right.
And I think same thing, like it's okay to be critical of yourself in certain situations, but you don't want to. So I always think it's so interesting. Like you think about some of the major chemo drugs, like methotrexate, for example, like we use that for autoimmune conditions because it will actually calm the immune system down. But if you have, let's say you have, I don't know, like some sort of autoimmune, and they give you that, eventually you'll get cancer, right? You become more at risk for it, right? Or sometimes they use methotrexate to treat cancer, and they will sometimes end up getting autoimmune conditions.
Yes.
Which is just so interesting. It's like one extreme to the other of the immune system.
And that's like the delicate dance that you
have to
do
balance
when, you're dealing with drugs that are messing
really,
with the immune system, for sure.
Yeah. But I think just thinking about that spectrum, like in our emotional state, like, it's important to set boundaries and like, be like, I'm not, but it's also important to be able to, okay, I'm going to put the boundaries aside and I'm going to give of myself. Like it's balance, right? Yes,
exactly. It's balance. It's really like how integrated is that part? Like for the highly, self-judgmental and self-critical part, like, is that just like running the show constantly?
Yeah.
Or is that a part that I can look and be like, oh, okay, I see I'm judging myself. Like, is that valid, or am I just being a little too hard? Like, what's the relationship with that, and what's the capacity then for like the type C, right, who's like, no, I'm just not gonna feel sad, I'm just like, can you put on a happy face for a few minutes and then cry when you need to? Or are you just always wearing that mask? Are you just always putting on that happy face and maybe not even necessarily realizing?
You're so good at stuffing it down. You're like, I didn't even know I was.
Exactly.
Like it's down there so deep, I didn't even know it was there.
Yeah, exactly.
Yeah, and it does. Cancer isn't always the only thing that manifests physically, right? It can be other things. There
absolutely.
Just regular symptoms like headache or stomach pain, or it doesn't have to like turn into like a true pathology.
100%. It's like there's almost always an emotional underpinning no matter what the dis-ease is. It just I think when it comes to cancer, when it comes to anything life-threatening, you know, like I've seen a couple of ALS patients recently, and that's also something that, like, you know, not cancer, but also conventional medicine doesn't have a lot of answers for. And so whenever you're looking at something that's like, oh wow, that like really shakes you, people start to kind of look at that end of things.
Yeah. Well, and we talked a lot about like the neo-emotional release stuff on the last episode, but I remember we talked about Inside Out. Remember that movie Inside Out? But I was just thinking about like when any one emotion is running the show.
Exactly.
Like, and if you've seen Inside Out 2, when anxiety shows up and runs the show, you're like, okay, yeah, that I can relate to that. That makes sense, right? Like,
exactly. Yeah. And also, you know, just like with any disease, like there's nuance. So like a breast cancer may be manifesting for different kind of reasons than like an ovarian or a colon cancer.
Got it.
So it's always like looking at the location, the side of the body. Like there's so much that the body can tell you. And all my patients, when they come in, before we even sit down and talk about things, I'm examining their body. We're doing pulse, tongue diagnosis, iridology. Like we're really looking, okay, what's the body telling me here? Before we even understand like what you're experiencing and how does that compare. So it's really like ultimately what is the story that's being played out through the physiology.
Yeah, and I think that's such an important thing. I think sometimes we forget that our bodies are just trying to talk to us. The symptoms are just our body's way of being like, I like that. Nope, I don't like that. Nope, can you stop doing that? Like, and you know, I think, and I myself am guilty of this all the time. I get a symptom and I freak out. I'm like, oh God, this is, and I'm like, wait, no, my body has a headache because I just need to drink water. Or, you know, sometimes it's a really simple answer. Sometimes the answers are more complex, right? Or the things it's trying to tell us are more complex. But the body is always just talking to us.
Absolutely. And I think that's something you really just express so beautifully all the time is like, if you can listen to those whispers.
Yes. Then you don't have to wait for it to scream.
Exactly. Yeah. And this is just, we're just not taught, like we're so conditioned out of our intuition and how to really tune in and listen to our bodies. And most of us walk around up here and it's like, even a cancer diagnosis, like that's something I can solve. That's very common. Like a type C response is like, if I just do A plus B, then that equals C, right? Like, and it's just, sometimes it's that simple and sometimes it's like, maybe this is the invitation. I think the people I see who do the best are the people who really take that invitation from the dis-ease to just kind of reevaluate, like, where am I putting my priorities in life? Like, have I been spending time with my loved ones? When was the last time I called my mom? Like, do I even like the job I spend 14 hours a day at? Like, it's
just... the last episode that came out a couple weeks ago I was just talking about, like, love as medicine. Is there any love in your life? Like, do you love your job? Do you love, you know, can you tap into that? Or are you just stuck in, like, a rut of negative emotions?
Yes, exactly.
And you know, I think to what you've been saying, like, the negative emotions have good, valuable information for us as well. We don't have to ignore those. Like, they want to be felt, right? I think something you said I use this all the time now when explaining to patients, like, emotions are energy in motion, right?
Yes, exactly.
And I'm like, that's such a good way of thinking. And if we don't let them move, then they get stuck. And then energy gets stuck, and then we get stagnation, and the body doesn't work well.
Exactly. It's like, really, energy comes in waves, right? So same thing with an emotion. Has a beginning, a middle, and an end. Yeah. And if we kind of see the beginning coming up, consciously or unconsciously, and we stop it, it becomes a loop. And that energy loop just circles in the body. And so it is really important. I love that you use that with your patients.
Because people, they're like, oh, that makes sense. I'm like, you just got to make sure it's moving. It's got to move through the body. It's got to come out.
Be moving.
As long as it's moving. And I feel like it's so interesting. Like, I watch it with all my kids. Like, you know, they get really angry and it comes up and they express it and then they're fine. And then they move on and then they love each other. And I'm like, wow. Like, I think as adults, like, we get angry and we're like, well, I can't say anything about that now. And then we kind of like loop it down and then we get more angry and then we don't tell anybody and then all of a sudden we explode and people are like, whoa, where did that come from? You're like, well, I've been harboring this anger for like 2 years or whatever the emotion is that you're like, no.
And you get so attached to the story, it actually becomes more about the story than just getting in your body and feeling it and then being like, oh,
well, why don't you touch a little bit about neo-emotional release and that kind of work? Because I feel like it's such a powerful tool to have.
Yeah, absolutely. So it's an integral technique where we're basically, you know, we're using targeted, gentle body work expressive breathing, some verbal guidance, some subconscious visualization. And we're really just providing the body the safe space to really finally show us what it has been holding on to. So all these emotions we've been talking about, from, big T or little t traumas that have been stuck in the body, we're just giving it the space.
Yeah.
It's really, the release comes from first the feeling and expressing finally of those emotions that we weren't safe enough to feel and express before, but then also releasing your resistance to your emotions in general. So transforming your relationship with them. So just because I have a great release of anger in a session, I've never really felt anger like that before, does that mean that I never feel angry again? No. Actually, it
allows you to probably be more at peace when anger does come up, right?
Yes, exactly.
Not scared of it.
Yes, it's not just about the catharsis, and this is important. And that's why sometimes a good cry feels like a good cry, and sometimes crying doesn't feel so great, is because it's not just about the release of energy, it's also about how are you holding yourself in the emotion. What's your capacity to really be with it and to receive whatever the message is, and also to just enjoy the experience. I mean, there's people who have had ecstatic grief because it's just pain and pleasure, right? It's very much so related in the neural pathways. And so it's how do we actually open ourselves up to having a different experience with our emotions? And in the context of cancer, I'm generally not jumping into a session with someone on active treatment, because that's just a little bit too overwhelming.
Too much for the system.
But I absolutely am always bringing up this concept that you're telling your patients as well, of the emotion is a wave. So if you can start to recognize your patterns of avoidance and distraction, and start to be okay, the question is always, can I allow this? And if you can allow yourself to be with what's there, and just really using even the visual of a wave is so helpful, that as you breathe, let the wave come up and witness when it comes down. That can be so helpful. And then making space also for joy. And there was a book that was written by Kelly A. Turner. She's a researcher, called Radical Remission.
Oh yeah, I've seen that
book.
Have
you heard about it?
Yeah, I've heard about it.
So really great. I mean, conventional cancer patients that basically conventional medicine said spontaneous remission, which means we don't know what happened, but they don't look into it. And so this woman was well, they had to do something. So I want to know what they did. So she found really 10 factors that were quite common to all of these people. And there was nutrition, there was supplements, there was IV treatments, and all these sorts of things. But what most people found to be the most impactful for them was the mental emotional stuff. And it was making time for joy, but also allowing, the sadness, the anger, the grief, the fear, all of these things also to come through. Community, right? Really prioritizing, again, that's the connection piece of how connection is the medicine. And then spiritual as well. So not just having reasons why I don't want to die, but actual real reasons for living. Why
are you passionate about being alive? What lights you up? Having something like that.
And feeling a part of something bigger than yourself, whether that's a community or a religion or even just a family, right? Being a part of something greater.
Which is almost as you said, it's that cell needs to feel like it's a part of the body. You know what I mean? That's such a micro is the macro, whatever that, thing
Exactly. It makes so much sense. And there's just so much of this, mental, emotional that weaves in so well with the conventional treatment. There's actually a really great resource, I think it's from Sloan Kettering, of meditations for people who are going through different kinds of either chemo or radiation. And I've offered them to several patients, and they say that they notice a difference in how they feel in the days following when they listen to the meditation and when they don't. And it's even just being present with yourself while you're receiving something like chemotherapy makes a difference in how that medicine is working for you. So it is chemicals, and you can see it as poison entering the body, and that's going to resonate with how your body receives that. Or you can really
look at it as you can have the placebo effect and be oh, hey, this is actually really helping me.
Right.
And change that.
Yeah.
I feel like I've talked about this in the last few episodes. I did a Joe Dispenza retreat at this point now, a few months ago, and it was so cool, and some of the stories he shared. And if I know you follow
So
him,
cool,
and if you're listening and you don't know about him, please go check him out.
Yes.
Everything I've talked about him like every episode for the last few episodes, because it was such a cool experience. But he shared story after story about patients with stage 3, stage 4 cancer that would do his meditations and spontaneous remission.
Amazing.
He shared this one story about this woman who was diagnosed with stage 4 colon cancer. And she had, most of her colon removed, couldn't be more than 10 feet from a bathroom, couldn't go to one of Joe's retreats, but she did his meditation. She would do them on the toilet. And after 3 months, she was able to get through a whole meditation without using the bathroom. And she was like, oh, it's working. And then another 3 months go by, and she was able to actually go to one of his retreats, didn't have to, was fine. And then she went back I think it was maybe 7 or 8 months after she'd started doing meditation, she went back to her oncologist. They did a scan. She'd regrown more colon tissue than had been removed. I know, and we were all like, what? And he was like, I still stay awake thinking about that woman.
Oh my God.
That is just the most amazing thing. But, she was doing obviously a million other things, but she was doing his meditation. She was getting in touch with herself. She was a part of a community. She was a part of a higher power. She was doing so many of these things. And also, his meditations, you spend such a long time in that elevated emotion state. You're full of love, gratitude, joy. And what that does to the physical body, if you listen to the last episode that I did, I talked about that as medicine. And it's the most powerful medicine that's out there.
That's a really incredible story.
Yeah, really incredible story.
It's so
that's
amazing.
Not something that you see. Anyway, he was sharing about patients who have their thyroid removed. And I've seen that more times than I can count. Patients who had their thyroid removed in their 20s, and then they start feeling weird stuff. We send them for an ultrasound, and they've regrown half their thyroid. And they're like, what? Their numbers are still fine. But the body is amazing at healing itself. And the body wants to be well.
It wants to heal. It just needs the resources. And that's really what Joe Dispenza is doing, is he's resourcing
so much
the
energy.
Next level.
Yes.
To the
Teaching
next level.
you how to resource this unlimited energy.
Oh my gosh, absolutely. And the resourcing that he does, it's, there's elements of that in the neo-emotional release too. And so taking it to the next level, to really keep the remission, I think it's important not just to resource, but also to resolve the underlying trauma. And so that's really the next level, is if you can resource to that degree and then use that, that resource that you've cultivated to then look at the things that were too painful or challenging for you to look at before and bring that resource there and bring your presence and your healing to that. That's how you really, really stay well.
Yeah, which is really cool.
Yeah,
you can
it's
all
so
access
cool.
that and I just think about the impact that if everyone was doing this work and doing what impact that has on just our whole world, right? On society, on politics, on all the things because when we're in that state and that love elevated state, feeling, it makes us, we're better people, right?
100%. I mean, I feel this way. I actually had 4 first-time neo-emotional release sessions this week, which is way more new people than I usually see in a week. And it's just always so cool to see someone's response after their first session of connecting with themselves in that way, where they almost don't even know what to say.
Yeah.
And it's everyone's process is so uniquely different. After so many sessions, and even after just seeing so many people naturopathically, you see so many different variations of life that it helps you to just you just can't help but fall in love with life and with people and with humanity.
It's amazing how much the body can heal. And
exactly. And that's that is you're saying, love is medicine. When you can fall in love with yourself, your body, your
fall
fellow
in love
man.
with your body's ability to heal itself.
Yes.
Right?
It's and I think a lot of people too, especially when they come to the neo-emotional release, they're people are always saying oh, just listen to your body. But you don't really know what that means until you have that experience. And sometimes it's hard to get there on your own. And that's why it's so important to work with a provider who's holding you and guiding you in that process. Because once you feel it, it's different from just knowing it in the mind. It's I know I'm supposed to listen to my body, but
But it's almost our bodies speak a completely different language. And if you're not taught the language, it's going to a foreign country and you're I have no freaking clue what they're saying to me. And sometimes we don't know. My body's having XYZ symptom and, but when you are a provider and you've worked with so many different patient types that have had similar, we're like, oh, okay, well,
Yeah.
I can tell you that the majority of the time this symptom means this.
Yes.
Now, that's not always true, right? Everyone's body has a slightly different language, but I think when
Totally.
you work with a provider, we can help you figure out what your body's trying to tell you.
Absolutely.
I mean, and if you can't figure that on your own, I mean, sometimes people think when they really tap in and they are able to intuitively listen, they're going to know,
Yes.
right? And I sometimes think patients know, they just don't trust themselves, right?
Yes, and that's like where you come in for confirmation, right? But
Yep.
also teaching them, what does resonance feel like in your body? Like,
Yeah.
how do you, like, what is your relationship? What is your degree of presence with
Yeah.
yourself? And teaching them how to really figure out what's working for them, what's not working for
Yeah.
them, and how to just drop into that state of listening. Because I think
Yeah.
we go first into the fixing,
Cerebral. Yep.
solving,
I'm gonna
right?
fix this. What's wrong? Like,
Oh,
going through all
I see
the
this.
reasons.
How do I fix this? What could this mean? Instead
Yeah.
of like actually just like really dropping into that listening
Yeah.
and being open to the body responding in different ways, and also being open to like not getting an answer right away.
Yeah.
Sometimes I say it's just like, just ask the question and be
Yeah.
open to receiving, because it might come in so many different ways.
Yeah, I sometimes find with my own body, again, I'm such a hypochondriac, which I've shared a bunch of the show, but sometimes I'll have a random symptom and like, because of this line of work, I'm always like, oh, is it this? Is it this? Is it hormones? I go
Yes.
through all the different things. And then I'll be like, okay, I need to get in, I'll need to just go like get in touch with my system and like meditate or take some downtime. And then all the symptoms go away. And I'm like, oh, my body was just like, you just need to go have some time with yourself.
Yeah, you
right?
just need
like,
to pause.
I didn't need to like overanalyze all the things. And sometimes this is true. I see this with patients out there like, oh, yeah, I had all these random symptoms and I just went and laid down for 20 minutes and they all went away. And I'm like, your body was just trying to scream at you in 15 different ways. Like, please listen to me. I need a nap.
Please lay down. Please go eat
Please
something.
lay down. Yes.
Like,
yeah, please recharge yourself, right?
Yes.
I think that's like, and the book I'm reading, like I think most of us are running on fumes. Like we don't we're not feeling ourselves, we're not resting enough, and we're spending all of our energy, but then we're not having any energy income coming in.
Yes.
And the body doesn't work well with that, right?
Yes.
It needs fuel, it needs recharge time. If your body were a phone, you have to plug your phone in.
Oh,
you can't use it all the time,
100%.
it's gonna die, right?
Yes, absolutely. I totally agree. And this is, with the nutritional piece too, where like fasting and intermittent fasting is so common. I think
Yeah.
there's a place for it.
Yeah.
But I think it's widely overutilized
It
because
is.
why are we
Particularly for women, I don't
Yes.
really think it's the best for women. There are certain stages in life where I think it's great, but and maybe like when we say, I usually to get nitty gritty on this, I don't like women to go more than 12 hours without eating. Like I think a 12-12 fast is great for women.
Yeah.
Men can usually go a little longer, but I have so many women that are like, oh, I don't eat for 18 hours, and and they don't
No,
feel good. I'm like, okay,
they don't.
we need
Yeah.
to-
It's just like
You need to fuel your
ultimately,
body.
You do. And the message that gets sent when you're giving your body consistent fuel too is like, there's no scarcity.
Yeah.
There's an abundance of resources.
Yep.
I'm giving them to you.
Yep.
You're safe. You can use these
Yeah.
for healing,
Yeah.
for energy, for whatever it is you need.
Yeah.
Versus, the body doesn't know there's food in the fridge. It just knows it's not getting any
Yeah.
for 12, 14, 16
and then
hours.
it's like, oh, I better store everything you eat in the next. I better store it. And this is, I
Exactly.
think it backfires when you're trying to lose weight
Oh
or trying to
yeah,
have energy.
because our adrenals are already totally tanked. You know
Yeah.
this super
Oh, yeah.
well with
Yeah.
everything you're researching and writing,
Yeah.
and so it's like, why would we add another layer of
Yeah.
stress
Yes.
onto the body?
Yeah.
It's got plenty.
Yeah, it already has enough. It has enough to deal with. Yeah, let's fuel your body.
Yeah.
Yeah, but it's funny. Like I have a lot of patients that they're in go mode and like busy all the time, and they're not hungry because their digestion's shut off. Right? Like when it was so funny in the Joe Dispenza meditation retreat. Like there were so many people that like as soon as we started meditating, like their stomachs were growling.
Yes.
Everyone's like, I'm starving. Because, we were activating like the true rest and digest. And like people were like, wow, I'm really hungry. I remember I was like, wow, I'm eating a ton this week. Like,
Yes.
I'm like really hungry.
Yeah, it's like your life force. Like
Yeah.
you become more also just like hungry for life.
Yeah.
Right? Like
Yeah.
always mirroring that. I see this all the time in emotional release sessions too.
I'm
People are
sure.
like, oh, my stomach is moving. I'm like,
Yeah. You're like, ooh, because we're like moving things around.
Yeah, the moment you pause, like, I always say too, like hunger, thirst, like when your mouth is dry, when your stomach's growling, like that's your body's last ditch effort.
Yes, to tell you.
To tell you I
I'm
need
starving.
food or
Please
water.
feed me. Yeah.
So it's also recognizing like what are maybe the moodiness or maybe the
Yeah.
headache that comes on midday.
Yeah.
Or maybe the fact that you can't focus without, 4 cups of coffee in the
Yeah.
afternoon. Like
Yeah.
these might actually be signs that
Yeah.
your body needs food.
And I think the earlier on in life that you can start to listen and just start to like work with your body, the less likely it's going to be that you have some catastrophic health event that I had a patient I've been working with for a long time, and she was like stressed to the max. Her job was, they just like ran her into the ground, and she loved her job. She'd been there for a long time, but she was raising 3 kids and like had no time for her kids, no time for herself. And she got Bell's palsy, and she had a very like active, like she was on camera, and like it was a very like, and she had to take time off of work, and it was like almost a month, and she was devastated because she loved her job, but her body was like, I think her body had been trying for a long time to tell her like, hey, you need to stop, and she wasn't listening, and most of us don't listen because we're like, no, we got to do this, and she took some time off, and she really worked on her health. And it's funny, and we talked a little bit like during this time, and she's like, I think my body's really telling me I shouldn't go back to work, but I really kind of have to go back. And she went back, and she felt terrible. And I just saw her a couple weeks ago, and she's like, I have some news. I'm like, what's up? She's like, I left my job. She's like, I have 6 months off, and then I'll start looking again. And she was just like, she just like lit up, and she's like, she's like, I'm gonna have 6 months to like really like listen to my body and focus on, and but she'd gotten to that point where like I think her body had been whispering and talking, and she just wasn't, and the body was like, wow, maybe I'll give her this, and that will make her like not be able to leave the house and have to rest, right? And I think that happens, and I think sometimes like for people, like a cancer diagnosis can often be a wake up call, like, you've not been taking care of yourself, you've not been setting boundaries or whatever it is, like, and then you deal, and it's so cool when you meet a survivor that was like, before my diagnosis I was doing XYZ, and now like,
exactly,
my life is completely changed.
Yes, some people are really able to see the disease as their greatest gift. Yeah. And that's ultimately, always the invitation from the body. Like the body isn't, it doesn't really want to kill you. It doesn't really want to make you suffer. Yeah. It's just like, sometimes it takes things too far, as we all do, right? And I think that's like a really beautiful story about how like when you open yourself up to receive the message from whatever it is that's going on, there's so much that can open up. And now like look at the joy that's like just come from that decision. Yeah. I mean, people's jobs, I think they really, we just underestimate how much it impacts your physiology.
Yeah. Well, we spend so much of our time in our work, right? And
almost all of it.
Yeah.
Right?
And sometimes, I mean, I've got patients that are like, I work this crazy job, and then they're like, I make all this money, but I have 0 time to enjoy it. I get home on the weekends and I'm so exhausted I don't do anything. Right. And they're like, is that really living? That's not really living. Like, but it's going to be hard. And I think when someone, and I've seen this a lot, when someone comes to the realization like, wow, my job is definitely ruining my health, that's a hard thing for a lot of people to change, right? Like in a job, it's often tied to our identity, like who we are. Yes. And so it can be really, really tricky.
Yes. It's hard to let go of the stories of like who, like, usually and especially in America, right? Like the first question is like, oh, what's your name? What do you do? Like the job is who you are. Yeah. So, like, oh, I'm a naturopathic doctor even. Like we hold so much identity to that. And so it's like, well, who would you be if you weren't that job? Yeah. And it's like, it's such an incredible like expansion to really explore who you are outside of the job, but it's also one of those things where it's like, oh, there's a crumbling and a falling apart
that has to happen first,
before we bloom into sort of like the next level.
And I've seen enough patients over the years that have kind of come to that realization, and either their body forced them to, or they made the hard decision to, and like, it's so cool to see what happens after that. Like oftentimes they'll start their own business, or they get offered an even better job with like better pay and less hours and flexible stuff. And it's sometimes I think when you take that leap, like not only will your body be happy, but it's like the universe kind of like opens up a little bit.
Exactly. Yeah. It's letting things that really truly are not in alignment with you fall apart, makes the space for things that actually aren't in alignment to come your way. So many times I've seen after new emotional release sessions that people,
because they're realigning their systems, right? And so then the stuff that's not aligned kind of falls away.
They leave their job, they leave their partner. Yeah. I mean, after our first training, there were so many people who broke up with their partners. I'm sure. Because it was like
I'm not aligned with them anymore.
No. And it's like, it's incredible because it's like, all right, I've been with this person for 7 years. Like, it's all I know. But then once you get into that, like, but that's not really,
it's not serving me.
It's not really for me. Yeah. It's not really what I want out of life. And like ultimately, what is life for, right? If not to be enjoyed. Yeah.
And your body knows. You might consciously be like, no, this is the right choice. It's funny, I had this case when I think I was a 4th year med student, and she was like a 22-year-old girl, worst case of hives I'd ever seen. I mean, she just had chronic, idiopathic urticaria. Like, and we ran every time. I mean, it was kind of a cool experience as a student. Like, she let us run. She was just like, I don't care, run everything. We ran all the blood work, all the specialty tests. Couldn't find anything. I mean, literally nothing. Like, her labs were perfect, which is pretty unheard of. Usually in naturopathy, we're usually able to find something like, oh, your gut flora. I mean, we were like, wow, she's like a textbook, perfectly healthy individual with these crazy hives.
Wow.
And eventually, like after like 3 or 4 months, she was just like, well, I don't think you guys can help me. And we were like, yeah, I'm really sorry. Like I thought we were going to figure it out. I ran into her like 6 months later, randomly, like at the grocery store. And she was like, oh my God. Like, and we said hi and she looked great. I'm like, oh my gosh, the hives. She's like, they're gone. And I'm like, what happened? She's like, I broke up with my boyfriend. And she's like, they literally went away the next day. And I was like, no. Wow. I mean, we didn't, and and I think we'd asked her and she'd just been like, yeah, I'm dating someone. And like, she didn't even have and I didn't go into all the details with her, but I'm sure it was not a great relationship, right? She wasn't married. I think if it had been like a long marriage, someone would like talk about that. But I think she'd been with him for like a year, but her body just was like, nope.
Wow.
This person isn't for me. And not that she had an allergy, but I think her body was trying to tell you like something is not right.
Absolutely. You know what else I've seen too is people who move.
Yeah.
And it's not actually a move that maybe
move to a new state or to a new
moved
house
for husband's job and they were kind of brought along for the ride, but they were taken from their family
or their job or whatever. Yeah.
Whatever it was. I've seen lots of women have either I've seen breast cancers.
Oh, interesting.
And I've also seen just like hormonal stuff like infertility. Like my mom actually, her breast cancer developed after we moved into a new house that was, it wasn't even very far. It was like 10 minutes from where we had lived, but it was like very big house. And it was like, my dad's an engineer, so he designed it. It was his dream house. But my mom like wanted everyone to be like,
close together. Yeah.
So she didn't like love it, but she moved there for my dad. It's again, correlation is not causation, but it's just something that I've seen a handful of times with women. And that's, again, work, where you live, who you're in relationship with. These are just major things that don't just impact your mind.
They're inputs that are coming into your body, right?
Absolutely.
And they'll affect everything.
Yeah.
And sometimes I think this is not the easy thing to look into. I think sometimes when patients come in and like, they're like, well, it's got to be the food I'm eating. It's got to be this. And yes, that stuff needs to be investigated. But sometimes I always have a hard time when I sit down with a patient and be like, okay, I'm not sure that it's an actual truly physical inside your body thing. It might be something else. And that can be a tricky conversation.
Oh, for sure.
Sometimes I think people are like, damn it, I knew it.
Yeah.
I knew it. I really didn't want it to be my house or the move or the partner or whatever, or the job. But like, you're right. I need to do something about this.
Yes. Except it's just, are you sure there's not a supplement I can take? I really have to quit my job.
Can I just take the supplements while I'm still in the job? I'm like, of course, we can do whatever you want. Or,
we can out supplement that job.
Oh,
no.
Yeah. No, this is we've done a couple episodes on mold toxicity. I have another patient right now that like early 20s moved to a place in Florida and like a million symptoms. Like she had to quit her job because she couldn't focus at work. She gained like 30 pounds. Her face is breaking out, all these things. And, she could see black mold on the ceiling, but she didn't know anything. So she comes to me and she actually moved back home for a little bit and she's been like, 80% better since she got out of the place. But she's like renting that place. Her boyfriend lives there and she's like, I don't know what to do. Like, I want to go back there. That's my life that I'm building. And I don't really want to move. And he's not going to want to. And it's so tricky. Like, these are not easy things we're talking about, guys.
It's not.
I don't want you to feel like we're like being, just quit your job or just leave your place. This is not an easy thing. But I think all of these factors, if you're struggling with something chronic, do need to be addressed, right?
Yeah, absolutely.
And you just need to like think about it and say, is this something that could be impacting me?
100%. And it's always a risk-benefit balance. Like, I think as naturopathic doctors, we really put like your physical health on top of everything else. But, there's different aspects of your health that you need to consider too. Like if you're social, relational, emotional health, religious, it's all more important to you, your spiritual health, than the physical. And staying there, even if you're suffering a little bit physically, it means more to you in those other aspects to stay, right? Like, then that's a decision that you make. So it's always like really just evaluating what matters most to you.
Yeah, where are your priorities and how's it gonna, So this has been a fantastic conversation.
As always.
Yeah. Where can people find you if they're interested in neo-emotionally or if they're like trying to refer someone that, needs oncology care?
Absolutely. So the easiest way is probably my website, which is just marisacatapano.nd.com.
Fantastic.
And you can find my Instagram from there, my email.
Yeah, she's got great stuff on Instagram, so you can go
Thank
follow.
You.
Follow her. Thank you. Yeah. And you can go listen to the episode we did before. We dove a little deeper into the neo-emotional release, and which is it's just a great resource. I've been so grateful that she's here to help people with that. And so thank you so much for being back on the show. Thank you guys for listening, and we'll see everyone next week.
Thank you so much.
Thank you for tuning in today. If you enjoyed this conversation, be sure to connect with me on social media to find more helpful tips and information. You can find me at Dr. Kinney on all of the platforms. And please be sure to subscribe and leave a rating and/or a review. This helps grow the show so more people have access to this knowledge that leads to empowered healing. Love and light, and see you next week.